Out of all the treatment options out there, why would someone want to consider ketamine therapy?
In the short term, some of my past patients often report a rapid reduction in their symptoms, whether that be depression or anxiety. Sometimes that happens within a few hours after their treatment. Mental fog lifts a little bit. They can finally see the sun again. Also, improved mood, reduced anxiety, and better sleep.
And what are some of the longer lasting benefits from ketamine therapy?
Over the long haul, ketamine therapy can rewire thought patterns. And in doing that, it leads to a sustained relief of depression, anxiety, or other mental health challenges. Patients often become more resilient, seems like. And by saying that, I mean they are more resilient and better equipped to handle life's ups and downs. It can handle stress and sadness with more grace instead of a crash and burn type of reaction. And that's what I've encountered.
Can you introduce yourself a little bit and tell us a little bit more about your clinical background?
Well, I'm Brem White. I've spent about the last 23 years in the medical or health industry, and the last several years I've really focused with mental health. I'm a family nurse practitioner, board certified, and I spent a lot of time with thousands of patients. The impact ketamine treatment has on people has really turned my focus and my passion to helping people with mental health disorders.
So, Brem, one of the things that I really come to admire about you is not only do you believe in the benefits of ketamine therapy, but you actually use ketamine therapy. And you've told me about some of the benefits it's had in your life. Can you tell us a little bit about some of that and some of the things that you've been able to overcome through ketamine therapy?
Yes, absolutely. So ketamine therapy for me has been a game changer. I've also had struggles with my mental health through the years. I spent time in emergency and witnessed some pretty uh, traumatic events, and also had some personal life events that were very challenging. And I think a lot of people do, with their family members passing away or, different types of loss, just stress from, a stressful job or whatnot. But for me personally, it really helped me rewire some of my thought processes, and I'm a lot more resilient and thoughtful, and have more grace towards myself. So it's been really, really good for me in that way. On a professional level, it's really helped me uh, have hope that I can offer something and help other people with their challenges as well. So that's the role that ketamine's had in my life thus far, and I'm hoping that it will continue to make an impact on my life and the life of others.
And one of the criticisms I've heard quite a bit about ketamine therapy is just how expensive and inaccessible it is to so many people. Tell me a little bit more about what you're doing to combat that and to make ketamine therapy readily accessible for those that need it.
Well, I think initially when ketamine was just starting to be used for mental health, it was new, and like a lot of other new therapies or treatments, it was slow going. And in order to get these clinics up and running, they needed a lot of overhead to keep them afloat. So the cost of ketamine in a lot of the clinics was really high to take care of the overhead. As ketamine has become more and more available and more studies are showing how effective it is, um, more clinics pop up, and they've kind of just kept that same pricing of really expensive. One of the things that is really important to me is making our best effort to make this available, accessible for everyone who is suffering or challenged with these mental health disorders. And one way that we can do this is to provide a different means, a different way for them to take it. We basically are setting up a way to have individuals do safe ketamine therapy from home in their own, private, comfortable space.
Why would someone want to consider doing ketamine therapy at home as opposed to in a clinic, besides just the cost? Obviously, there's, like you said, there's less overhead, it's more affordable, but what are some other reasons that they might be interested in doing ketamine therapy at home?
I think home-based ketamine therapy um, offers, of course, the comfort and convenience of being in your home, your own space. That's really important for a lot of people. Individuals that have high anxiety, social anxiety, it is very difficult for them to leave the house, sometimes even to go to the store. So if they have this thought of, I need to go across town, go into this clinic, and I don't know anybody, sit in a chair, have an IV hooked to my arm, and then go in this therapy. It's a really, really difficult thing to grasp and want to do. So they just some people will just stay home because they just can't do that. It's too much. Same thing with some individuals with severe depression. It's hard for them to get out of bed, and at-home therapy is just it's so much comfortable. You know the spot. You have a support person there that you trust and know, and you have a healthcare professional on the other side of the screen watching and consulting and monitoring to make sure everything is safe. So it's a really convenient, cost-effective, and comfortable way that you can do your therapy.
You mentioned a few things that you do to help make sure that your clients have a good and effective and safe treatment at home, but tell us a little bit more about what that looks like. What are some of the safeguards that you have in place to help make sure the clients have a good experience?
Home-based ketamine therapy involves a thorough initial consultation to ensure that it's right for that individual. And by this, I mean we go through medical history, medications, if there are any health issues that we're concerned about, just to make sure that this person's a good candidate and that the treatment won't possibly affect them negatively. Of course, we monitor through several of the treatments. There's guided sessions and follow-ups very often, just to make sure we're all on the same board, or all on the same page, sorry, with the treatments.
Awesome. And you mentioned them having a support person. Do you help train the support person so they know what to do throughout the treatment, or what instructions given to them?
Yeah, that is a great question. And yes, we do. The client is able to choose somebody that they trust, that they know will be there, and then we get to meet them, and we go through the instructions of what they can expect, some of the possible side effects or things that might happen, so that they're aware. They also know what to do in case of an emergency, which is very, very a low chance of that happening. But they know what to do, and we're right there with them as well.
What are some common fears or misconceptions that people might have that can prevent them from seeking help through ketamine therapy?
That's a great question as well. Many people have fear that ketamine therapy is going to be similar to the recreational drug, or that the side effects are going to be pretty horrendous. This is something that we don't need to worry about. Ketamine has been on the market as a medication since the late 60s. It's a very safe medication if monitored and administered by healthcare professionals. The dosing that we use for mental health is really low compared to it being used for like surgery or something like that, like a little tiny, minute dose compared to that. So it's very safe. Another fear that some people have is that are they going to get addicted to this medication? A lot of people have that fear about lots of different medications, and it's a legitimate fear. But again, the way that we monitor, the way that we prescribe, the way that we treat people, the chances of those things are extremely low.
Yeah, that's helpful. I know that getting mental health help can be really scary. There's a lot of still kind of this taboo element to getting mental health help. And I
Hmm.
think, to your point earlier, I do think that getting help in the comfort of your own home, I think that can really be beneficial, and that can help people kind of overcome that stigma or that fear of what are people going to think about me if they find out and things like that. And I really appreciate
Absolutely.
and I appreciate you just taking the time to really clearly explain the benefits of ketamine therapy and some of the, I guess, expectations that someone can have when they decide to get treatment. So if someone's on the fence about whether they should get ketamine therapy or not, and they're just trying to decide, do they want to give it a go? What's some advice you have for that person?
Um, there's a lot of hesitancy with not only ketamine therapy, but just, going in and speaking with a psychiatrist, starting a medication, trying something different. It's scary. And I think a big help with this for most everyone is talking to somebody that knows about it, learning more about it, asking questions, clearing up some of those concerns so that you're feeling more confident. Also, just looking at the benefit that it's had on so many other individuals. We know that the first step is usually the most difficult, but also the most rewarding. So once they're able to, go for it, then they're gonna really be glad that they did.
So if someone wants to reach out to you and get more information about ketamine or even consider whether treatment's a good option for them, what's the best way for them to do that?
Uh, our website, KetaKalm.com. That's KetaKalm with two Ks. Also, we have an email, phone number, and we're always happy and available to help and answer questions. We really do care about each individual, and we want to help. And we know that everything is very individualized. So don't hesitate to call in and just check it out. There's no pressure. We're just here to listen and to offer help.